I'm Dr. Omar Farooq. I'm board certified in internal medicine and practice in Ben Salem. Today, I'm going to talk about coronavirus. As you know, there's a pandemic of novel coronavirus disease, COVID-19, in the world that first started in Wuhan City, China in 2019. The situation is changing rapidly on daily basis. There are over 130,000 cases and over 4,000 deaths worldwide from the coronavirus disease. There are 938 cases with 29 deaths in the US. In Pennsylvania, we have 22 cases so far. The governor of Pennsylvania announced all schools from pre-K to college in Montgomery County will be closed. The US government has restricted travel to Europe for 30 days. So what are the symptoms? 80% of the patients have mild disease like cough and fever from which they can recover. Around 15% of the patient has severe disease causing shortness of breath and pneumonia. 5% of the patient has critical disease causing multi-organ failure. And there is 2% mortality rate. Patient may also have other symptoms like muscle pain, fatigue, or diarrhea, and stomach upset. Older patients and those with chronic medical conditions are at higher risk for severe illness. So how is the virus transmitted? Transmission of coronavirus is mostly via air droplets emitted from the infected individual over a distance of up to 6 feet via coughing and sneezing. If these droplets comes into contact with the mouth, nose, or eyes of the individual directly or indirectly, he may become infected. A person also gets the coronavirus if they touch a surface that has viral particles on it and then touch their mouth, nose, or eyes. The coronavirus can last up to 5 days on different surfaces, including steel, wood, glass, and plastic. However, the coronavirus can be efficiently inactivated by the common disinfectants. So how we diagnose the COVID-19? If someone needs to be tested, nasopharyngeal or oropharyngeal swabs are taken and the samples are sent to a special lab for the diagnosis. So who should be tested? It's very important. If anyone has recently traveled to high-risk areas like Iran, China, Korea, Japan, or Italy, or has come in contact with a known coronavirus case and has fever, cough, difficulty with breathing, and stomach upset, they are advised to stay home and contact their doctor to be tested. Also, if someone has these symptoms, even they have not recently traveled, they should stay home and contact their doctor. How to manage COVID-19? There is no specific treatment currently available for coronavirus COVID-19. The treatment is symptomatic. For example, take Tylenol or Advil for fever, headache, and muscle pain. As of now, there is no vaccine is available. The US Department of Health and Human Services is working with partners to develop a vaccine, which might take a year or a year and a half. Therefore, preventive measures are the best way to stop spread of coronavirus disease, COVID-19. So what can we do? Wash your hands frequently with soap and water for at least 20 seconds. Avoid touching your eyes, nose, and mouth. Avoid sharing personal household items. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. Avoid close contact with people who are sick. Avoid shaking hands while the outbreak is ongoing. Restrict your visit to nursing homes and hospitals. Stay home when you're sick and contact your doctor. Consider canceling and gathering of 20 people or more. Restrict all travel to Europe for next 30 days. Stay safe, wash your hands, and don't touch your mouth, nose, and eyes. Thank you. Live healthy, live long.